Take 26.25. Boomer has technology. Be careful. All right. So, anyways, we're at a point now where you may, you may, you may, if you're holding like disappointment, regret, hatred in your heart towards other folks. And normally this is over stupid shit. You might want to make your amends now, because I believe that this coronavirus that was turned into a biological warfare weapon in Winnipeg is going to come back to haunt us. If you take a look at when the doctor first reported it and got shut down by the coppers and threatened, just shut the fuck up, threatened, right? When he was trying to warn his people, his society, his government, right? That was what, beginning of November, so the end of January, everything goes fucking awry. And it's still going awry. It's going awry more than anybody can think. So you might wish to just find it in your heart just to settle a few accounts, good or bad, before, say, well, let's see. First one here, over here in the Great White North, we're talking end of January. So March and April. So April could be our peak over here. Seriously. So what I'm going to do, if you have the patience to watch this and read the bylines, I am going to play the bylines. So check this out. Huh.
他都已经喘不过气了。那个停，刚才3个，现在几分钟？5分钟了，现在已经8个了，又来了1个，来2个。你们还有尸体吗？还有啊，这么多！哎呦，这家伙这有太多了呀，这样还在搬，这尸体还在搬。哎呦，8个尸体。
The most alarming evidence is a phone call Epic Media Group's undercover investigator made to one of the crematoriums in Wuhan on February 4th. The conversation shows a simple yet heart-wrenching fact. The math simply doesn't add up. The actual number of bodies being cremated doesn't match the government figure by a large margin. Here's the highlight of that phone call.
就是目前的工作量，你们现在感觉到怎么样？还可以完成，对吧？如果再增加，
压力很大，
压力很大，
压力很大。你要是听真话还是要听假话？
你当然要说实话了。我们
实话我就跟领导说，我本人都要快崩溃了。
哦，你讲讲看，为什么？
我现在压力非常大。
那为什么呢？你们现在的
我上级重视这个问题，现在的重心都在医院这块。
对。
我们这块被人遗忘了。我们现在每天的运气量和火化量是平时的4到5倍。我们的人员从春节前到现在，人头上没有消息。
哦，就是。
而且还得不到人员的补充。
那你现在说4到5倍是一天，像昨天你有多少？
我这个数字我不好跟你说，因为我不知道你的真实身份。你光一个电话，我这个按照上级的要求，这个数字不许随便说。因为我刚才已经跟你讲了，现在的业务量是平时的4到5倍。
4到5倍。那你这个业务量是从什么开始？你是从什么时候开始有这么紧张的？
从腊月的29，这个数量就不断在上升。
你说的就是说
已经达到最高峰，腊月29应该是元月23吧，23还是22号开始人数就感觉不对头了，这个人数就上升了，有点猛了。
那你们现在是这个每天是3班倒吗？
不叫3班倒，领导，哪有人3班倒啊？我现在能够排2班
哎呦，
我在这个地方已经是每天能够睡上2、3个小时，已经是很幸福的了。
哎呦，那是你们辛苦了。那现在你看，如果说给你们增加人员的话，需要多少人可以满足目前的这个量？
增加人员。
啊。
如果按照昨天的那个量的话，至少要给我增加40到50个人。
40到50个人，那你们现在有多少人？
我现在有110多人。
哦，110多人。你们一共有多少个炉子？
我的炉子设备共有18台，但是能够使用的只有11台。
11台。
能够使用的只有11台。
那你这一个？
为什么只有11台？就是他妈的一帮人欺负我本来招标，搞的，最后他妈一帮他妈的反腐倡廉，我们坚决支持，但是不能他妈的那一帮人无视是妈的这是管。算了，我不想跟你多说了。
你这样，
搞到我们设备没有。
哦。
我们基层的底下难了。
那你那些11台可以工作，那是不能工作的是坏了吗？还能不能修？
有的坏了。有的是完全不能修了。前天好不容易通过市指挥部从外地找了2个维修工过来，你知道现在封城。
我跟你说，我马上派人来给你维修炉子啊！你现在是需要什么？我问你，你现在需要什么？除了需要人，40几个人，还有什么？
需要人。我现在就差人，我的人太疲倦了，太疲乏了。
对。
完全得不到休息。你刚才还说3班倒，我现在2班倒都做不到了。
哎呦，那你这2班倒24小时，那就1班就得要10几个小时啊！
我的人员都没回家了，领导啊！
哎呦，那你现在一个人一个炉子要几个人看？是一个人看就行了吗？
我一个人要管几台炉子。我火化工加上维修的总共才是12个人。
那你刚才不是说你有100多个人吗
？100多人，还有些女同志。我现在车队那边，我9台车，每台车配4个人。2班倒，领导你算算，我全管的男同志全部去接运尸体了。
那你一台车能当？
同志都去搞调度、接电话、消毒。
那你一台车一次能拉几个人啊？
以前一台车拉1个人的。
现在呢？
我们现在把里面的隔的那些东西给拆掉了，再少拉2个，然后把我的那个以前不是殡葬式的中巴车，把椅子卸掉，一次拉7、8个。
哦，这样的话，那你11台炉子哦，那你这11台炉子那是少了一点。那一台炉子，那处理一个尸体需要多少时间啊
？50分钟。
50分钟。哦，那能不能缩到半个小时？这个能不能缩短？
缩不了。
那有些地方说是45分钟，40多分钟就可以了吗？
那我不知道人家的设备是怎么回事。
哦，你们的50分钟。
烧到50分钟。
对，50分钟，那也是够忙的了。哎呀，那你这个真是够忙的了。
我不是说我这要崩溃了，就是这样。
那你原来正常的情况下不需要晚上值夜班的嘛，对不对？
以前按照武汉市的习俗，12点钟以前要落帐。所以说我们就是从一大清早上6点多钟开始上班，
对，
火化，到中午就不干了。
哦，对。
现在的情况是怎么样？我告诉领导，遗体接运进来，立即火化不停。
哎呀，那真是现在够忙。还有一个，那你现在每天能不能现在拉来的能不能完成？有没有积压下来放到第2天做的？
火化的积压的这个情况还不是太严重。主要是那个遗体在医院的，我们接运不及时。
哦，就是车少。
后来那个什么，我们武汉市的狗屁书记马国强，还说什么要我们在1个半小时把遗体拉完，拉得了吗？让他去书记亲自拉一下试一下。
哎呀，那是硬。
狗屁官僚主义。
那至少这个你们书记应该。
现在给我们下指标，要纪委的督查我们。医院病人死了以后，要我们1个半小时以内把遗体拉走。
对，那是。
能做得到吗？
那你叫他派车来啊！你叫他派车拉过来嘛，你们负责烧嘛。
我们没人要车没车。
那你叫那个书记，你说你给我拉个人过来。
是书记。我们现在主要是人力的问题，车给我增加这3、4辆都可以了，我的人现在受不了了。
人给你增加40、50个人。
小时， 人不停的去搬运接人。
哎呦，
我们现在所有的人去男同志全部投上去了，只要人他妈的能动的都上去了。
对呀、你知道他们其他几个殡仪馆情况怎么样？
只会比我差，不会比我好。
哦，你跟他有沟通吗？
有沟通啊。
你最近跟哪个殡仪馆沟通过啊？
我跟汉口宾馆沟通过，他现在的业务量比我还大，他的压力比我还大。
除了这个医院之外，有没有这个就是社区直接给你们拉来的？有些倒在路上的，他就不一定去医院了，对不对？
有。前几天我做了个统计数据。我们最近这个就是前几天数据啊。数据不代表这几天。
对。
这几天医院的就医情况有所改善。前几天我做了个统计。38%是医院接来的。
哦。
61%是在家里死亡的。
哦。
所以说这个就医的情况很不好，前几天。
对。
你想想，60%都在家里死的。
哎呀。
当然，这个家里死的不一定是这个肺炎啊，也其他我说的这个数字没有区分肺炎和非肺炎的。
现在大部分都是。
武汉市这帮狗官把这个城市管理的一塌糊涂。
The investigator called the funeral home again shortly afterwards and got this figure.
跟你负责任的说，昨天是我们最多的一天。
昨天是多少？你能不能告诉我一下？他说40多个，不到50个，是不是这样的？
我就姑且相信你一下。
你说。
我昨天总共接运的遗体，127个。烧掉了116个。
OK。
然后确诊数，确诊数是8个。我拖的这127个中间，根据死亡证书上面标明的确诊的8个，写的疑似的，是48个。我这是全部有死亡证书在我手上的。
好。
According to China's official records, 131 people are expected to die in Wuhan every day. Wuhan has 7 funeral homes, and they can cremate 135 bodies daily on average. Based on this information, Zooming In did a preliminary calculation. We concluded that since January 25, 2020, when the funeral workers said the number of bodies arriving at the funeral home started to rise, roughly 470 people died of coronavirus every day in Wuhan. From January 25th to February 12th, over 8,000 people could have died from the disease in the city. On February 12th, the Epoch Times reported that funeral service teams from multiple provinces were going to Wuhan to help transport and cremate corpses. These teams held ceremonies before leaving, where they held up banners that indicated where they were from and what their mission was in Wuhan. At the Center for Disease Control and Prevention press briefing at the National Press Club in Washington, D.C. on February 11th, I asked the CDC Principal Deputy Director, Dr. Anne Shackett, these questions.
All right, so let's take into account that those numbers, man, they're over 10 times. Over 10 times what they're reporting. So, like, if they were reporting 40,000 deaths, it could be like 400 or 500,000 deaths. And with that 3-month period to get rocking and rolling, we're probably going into a month of it now here in the Great White North, so probably got just over 2 months before we start seeing the results of a piece of shit public service that we have allowed to happen. This is our fault. All Canada's downfalls are our fault. Our fault. Letting Frankenstein just fucking go like this. So hopefully I'm wrong, but it's not looking good, guys. Not fucking looking good.
Now with zooming in NTD TV, some of the people have already touched upon this, but I just want to dig a little deeper. So when CDC make assessment of the epidemic, does it take into consideration that the official number from the Chinese CDC might still be very severely underestimated? Because, for example, the Chinese medical officials admitted that medical personnel admitted that the diagnostic kits they need to use to test the patients are very limited, only 10% of what they actually needed. And also we did an interview with one of the funeral homes in Wuhan City 2 days ago, and they said they have been absolutely overwhelmed. And they've been basically working 24/7, and 60% of the bodies they cremate are actually from home. 30% from hospitals. Obviously, those 60% of the bodies are not counted in the official number. So that's one question. I mean, is it still very, very severely underestimated? And question number two is regarding the quarantine center in China. We know China has this policy right now. If you have a symptom, it doesn't matter if you get a flu or anything else, or coronavirus, you are forced to those quarantine centers. We have seen footages of this Fangchang quarantine center with 1,000 beds, like very close to each other. So my question is whether those will actually increase the possibility of cross-infection, or is it an effective way to control the spread of the epidemic? Thank you.
Yeah, thanks. Those are both really, really important questions. We absolutely assume that the reported cases are an underestimate. The early exportation of virus to a number of countries was used by mathematical modelers to estimate what the total cases must be. If we knew of 41 cases, but this many countries were seeing cases imported among travelers using the known numbers that travel, there were some estimates of under-reporting. And it's a mix of not hiding cases, but really trying to keep up either with the mild cases, or, as you say, now that the disease is so common that the laboratory capacity can't keep up, or the kits aren't, there's not available kits. So we absolutely assume there's a much greater number of cases. And China's actually reporting what they call suspected cases, ones that haven't yet been tested. And then that's typically how we assess outbreaks and emerging infections. Your question about the quarantine center, theoretically a quarantine center should be people who have no symptoms, who are being observed to see, because you think they're higher risk than others because they've been exposed, you want to observe them, and at the first sign of symptoms, you want to move them out of exposure to anyone else so that they can be isolated. The concern about putting people who may be ill together could be a problem in terms of acquiring the infection. People who go in for something else like influenza or measles and then come down with the novel coronavirus. So that's why the circumstances of isolation are so critical. It's one of the reasons I believe that China built those hospitals with individual rooms so that they could keep people they knew were sick separate from others and safely care for them. But the ability to surge for a very large-scale outbreak can be challenging for anyone.
I also asked Dr. Lin Xiaoxu what it means for the rest of the world if the coronavirus epidemic in China is actually much worse than the Chinese authorities lead us to believe.
So that's why from this simple calculation, we can tell the situation is at least 10 times worse than the government exposed to the world. So that's why we really worry about the situation in Wuhan. And because this disease already spreading to so many countries, people always worry that it would turn into a full-blown pandemic. So right now, outside China, we just didn't see any country have a major, like a cluster case outbreak, and only smaller community groups or individual cases. So that's why the WHO didn't call it a pandemic yet. But it definitely has this potential to develop into a full-blown pandemic, especially if the Chinese government conceal the information and we know more than probably 10 times more people got infected. So definitely more people are still being infected. More people can, travel to different places inside China, and more people maybe even go to other countries. So that's why these data shows the potential for these outbreak to develop into a full-blown pandemic is much higher than the world knows.
But this is in China. Even if the situation is much worse than we know, would it pose imminent danger to the rest of the world, considering Wuhan and Hubei province are basically locked down, and many countries have implemented travel bans for Chinese nationals?
I think actually the whole world need to be very cautious about this outbreak because, in many countries that are bordering with China, for example, Vietnam's, Turkestan's, and, even Afghanistan, many of these countries, they don't have good public health systems. So many of the countries around the world, not like United States or UK or other, well-established, well-developed countries. And so those countries, if you got some people infected, some imported case from China, then it's a whole big disaster for the region. So, even for Latin America, so many Chinese people may travel to Latin America too. For Africa, for example, Cairo is one of the biggest airports that will receive many Chinese people. And many of these countries did not completely close down their airlines flying in and out of China, right? So that's why it's still a huge risk for the whole world. If any of the developing countries got a severe cluster case happened in their countries for this Wuhan novel coronavirus infection, then in these countries, it could quickly turn into an epidemic, and it can spread in a very uncontrollable fashion.
As far as I know, the Chinese authorities have not allowed U.S. officials to go with the WHO staff into China to investigate the epidemic. Why do you think they won't allow U.S. experts to go?
I think fundamentally because Chinese government still regarding the public health crisis as a state secret, and they still think the top priority for the Chinese Communist Party is to keep the so-called social stabilities. So they keep broadcasting these, they call it positive energy, telling the world, telling Chinese people they are doing great. They can lock down the city, they can build a hospital in 10 days. So many positive measures have been taken to contain the situation. But they don't want the whole world to know how much people suffer in this kind of quarantine down situations. And are there any loophole in the prevention measures? Are there any loophole in their supplying, for people's in the self-quarantine situations, and how many people die due to the humanitarian disaster that the government may created, and they may not want the whole world to know the true origin of this virus. So there are many questions regarding these, many issues maybe the Chinese government didn't want the whole world to know. That's why they keep rejecting the U.S. Infectious disease experts or disease prevention experts to go into China to investigate this situation. But I think the whole world should actually demand stronger to conduct independent investigation, or at least joint investigation.
But why do they allow other experts from WHO into China?
Okay, that's because WHO is basically a political organization, and even though it serves the public health purpose, but its leadership has a close tie with Chinese government, and also its mandate only asks the WHO to work with the government agency or government entity that they recognize. Even in Syria, in such a civil war situation, WHO can only work with Assad regime. They cannot with the rebel group. And so in WHO's operation, when they can work with Chinese government, they cannot work with Taiwanese people. So that's why it's a political organization. They cannot criticize Chinese government. So when they do the investigation in China, of course, Chinese government's opinion or Chinese government position will heavily influence what they can tell the world.
Coming up, the Chinese New Year holiday has ended. Xi Jinping forced the business to open. Could that cause a second wave of the outbreak? China's